Sodium hypochlorite is considered the gold standard irrigation solution in endodontics because its capability to dissolve the organic structure, its antimicrobial properties. Endodontic disease model is inflammatory disease caused by bacterial biofilm, and sodium hypochlorite is effective in distributing these biofilms. However, irrigation does not always reach the root canal system, such as the apical ramifications, lateral canals, and also isthmuses. Research indicates that activation technique can significantly reduce the biofilm and the bacteria. Among various activation methods, the gentle wave system is a cutting edge, minimally invasive technology that utilize negative pressure, acoustic, and fluid dynamics to eliminate debris and also to disinfect the root canal system. Gentle wave system create intense hydrodynamic activation created by a wide range of waves and high flow rate of 45 mil over minute. And in vitro and in vivo model studies have shown that gentle wave system is safe and highly effective in dissolving the pulp tissue and removing the biofilm, even with limited instrumentation for the root canal system. Until, until today, only 3 clinical prospective cohort studies have evaluated patients treated with gentle wave system. These studies reported only low levels of postoperative pain and swift recovery time between 6 to 12 months, which can be attributed to the cleaning abilities and reduce the risk of material extrusion. Now, no clinical study have yet compared different activation method with gentle wave for the canal disinfection as a clinical outcome study. A clear prior for this publication that was published in 2025 by the Journal of Endodontics, a collaboration between a UK and Canadian groups titled as Healing Outcome Following the Treatment of Molars using different root canal disinfection methods, a prospective cohort study. In their methodology, this prospective cohort study included 230 teeth or molars treated by a single endodontist using either gentle wave, and from 230, 120 was treated with gentle wave, and 110 was treated with ultrasonic activation and negative pressure irrigation. The inclusion criteria and exclusion criteria was followed up. All the treatment were done in a single visit following standardized instrumentation and irrigation. Final irrigation protocol followed the manufacturer and the guidelines of gentle wave or combined ultrasonic and negative pressure methods. And all the teeth were filled with calcium silicate base sealer, high flow type of sealer, and the radiographic outcome were assessed using preapical index, and that's the outcome variable that they wanted to assess or aim to assess from this specific prospective study. Using, of course, preapical index by 2 blinded examiners followed up to 1 year. And the outcome was classified either as strict loose criteria, which is healed, healing, or diseased. The statistical analysis was done doing 3-way ANOVA and compared the groups and the control for the follow-up time. Just to summarize the findings, their findings revealed after 6 months and at 1 year, only 170 teeth were followed up and no significant difference were found between the groups. The preapical index score improved significantly after the treatment in both groups. But treatment type and follow-up distribution or duration had no significant effect on the outcome. So when it comes to this publication, it has its own strengths, such as a prospective model, standardized treatment protocol, blinding the calibrated examiners, and also appropriate statistical analysis. However, it does have certain limitations, such as unequal case complexity, unequal group assignment, no randomization, single operator, limit the generalizity, high attrition rate, equal to 23% of loss to follow up. The follow up variability, large variation, and finally, no patient reported outcome, which is the satisfaction of the patient centered outcome, and also using 2D images. So, again, the limitation and the strength of this study. However, this study also it gives an idea for the use of gentle wave. And gentle wave, one of the biggest disadvantages of this type of activation um, method, it's very expensive. It has a very high cost compared with ultrasonic activation or passive ultrasonic activation. So, from this perspective, cohort study, it gives assessing the outcome of non-surgical, which is the aim of the endodontic treatment, is either to eliminate or to treat apical periodontitis. Uh, Gentle wave is very expensive compared to ultrasonic. So if there is no differences according to the study when it comes to activation, using a cheaper type of activation method is better. Thank you.